Many people don't know it, but recovery from a serious mental illness is possible. That help needs a lot of help, and this week it got a giant boost through the Kaizen process. My name is David Kahler. I'm a member of NAMI, the National Alliance on Mental Illness. That's the group that supports the families that have a member who is mentally ill. And we teach in family-to-family classes and support groups how to better utilize the resources that are available at this hospital. And that group is extraordinarily appreciative of these efforts, which so far I've seen have been quite effective. The repainting of the entrance to the CSU is a lot more than symbolic. I can see that the spirit of the recovery is among us.
My name is Teresa Pasquini. I am a family member of two Contra Costa County behavioral health consumers and a member of the Healthcare Partnership. After the time observations, the data collection and calculations were complete, we had our current state mapped. We threw out old attitudes, debated and challenged the obstacles that exist in the current state, and made suggestions for building an ideal future state. We had an amazing community team with open hearts and minds. We were told to think big and blow up the box. Our ideas reflected our diversity of experiences, our perspectives, and different perspectives. No idea was excluded or judged.
What this whole effort shows to me is that if you get the right people in the right room, particularly the line workers, but in this case, our partners, law enforcement, consumers, family members, patients' rights people, people who kind of pass each other in the night, but rarely have the opportunity to spend a week looking at problems. Replaces a whole lot of committee meetings and minutes and all the other ways we do business, and really ends up at the end of a week with a future vision, a plan, and some steps to actually move forward and fix things. That's the power of this. Realize when you open the doors to people who are looking at it with different views, not only do you dispel the mystery, but you also bring a fresh look at how we do business, and particularly a fresh look at the value added to our consumers as they move through that process.
To say that I'm proud of your work doesn't begin to do justice with how I'm feeling today. It's no less than thrilling to watch teams here make a difference in the lives of those we serve. You remind me that behind the best laid plans and the best intention, there is a patient in need. There's someone who won't be subject to the terrifying experience of being physically restrained because you've made the process of care better. Somebody who's getting the right care at the right time for the right reason so they can go home feeling better because you've improved the process. It's about 600 people who are no longer being rerouted through the medical emergency department because you asked us, why does it have to be that way? It's because you reminded us that first, there is the patient. There's a son who suffers acutely in behavioral health emergency, while a mother makes a heart-wrenching decision whether she should call for help, knowing what will inevitably happen to her son if she does, yet fearing what will happen if she doesn't. But now, if she makes that call, emergency personnel are going to arrive better prepared to provide help because of the work that you've all done together. And if her son comes here to Contra Costa Regional Medical Center, she will no longer stand at a door that says you are not welcome, please go wait somewhere else. Rather, she will be welcomed to a place of hope and a place of recovery. I think it's important to reflect on what you've accomplished over the last 12 months in the behavioral health team. It's no less than making a new world. I leave you with a powerful reflection made by Bernadette on Wednesday as she shared her reflections in the morning exercise. She said, I'm excited. We're going to make change and never, never, never give up.